after we got married, with my, Amitabh, Amitabh, right? He was also from the same batch. I guess after doing the senior residency, and he is also a pathologist. Um, so we sort of, um, after doing, I think, our medical school from one of the best schools, and also doing probably our senior residency from one of the best institution at the time, we did not see much future there. It just seems a little weird to say, but that's how it was, and I think it might still be the same unless you have a lot of push and things like that. It's very hard to move there. And private practice wasn't something which we thought we will be able to handle the things you have to you have to do to set up a private practice, although we were like a couple, so it makes it easy, I think. But then it's also at the same time is challenging, because then you are both sort of trying to do the same business. So but anyhow, I think Amitabh was totally against not doing anything like a private practice there, because of the scene, how it worked. And he always had a little ambition that to pursue academics further abroad. So I think that's how we decided when we were in SGPGI that we will we should give it a try, sort of. And so I think that's how it started. And then we, in June of 2000, he moved, and then I moved after a few months. Yeah, but because we also had our son, he was born, so we decided that we will do one at a time. Otherwise, it might be very challenging. So he started his residency first, and then I started my residency with a little bit of gap, because we also had family there and his mom and everything. So we had to wait a little bit for the
Yeah,
family to also settle with the idea.
yeah. So obviously you would have given your USMLE, or how did you be for your residency after PG? How is it? How did you?
So it doesn't matter whether you have done PG or not, um, because that's not really recognized here. So obviously, Amitabh did his USMLE on a very short notice, because he had done his ECFMG, used to be like a FM, prior exam. That's what they used to call it. Or maybe they still call it, but that became invalid for some reason. I forgot, because now it's been so many years, right? 20 years ago. I don't know why it was not valid anymore. So when he applied for residency, he got some calls. He applied based on his ECFMG, but then they said, we would love to give you a spot, but you have to do USMLE, because ECFMG is not valid anymore. So he gave his exam from India, and thankfully, I think in the same month or same year, they started computer-based exam, because the first exam he had given was in Lahore. Actually, it was the center. So you had to go personally and give the exam. But then he gave his exam. So they told, oh, we figured out that there is some computer-based exam starting in India. So if you can finish your exam within 3 months. So he did his exam within 3 or 4 months, which was quite a short time, but he was able to finish it, and then join the same June here. Session starts in June 20th or something like that, So then he moved, and it was a very short notice for us to, like, so that's why I did not come with him. So I was still pursuing my, my career over there. And then after a year, I moved. I did not do my exams over there, because it was too much, and it was on a very short notice. So when I came here, I did my exam actually within a year and a half. Actually, the year we came, September 11th, happened after 1 month of landing here. So it was a pretty challenging time here. So everything again got very disturbed, and it wasn't easy to go out and things like that. Boston was a place. We came actually to Boston. So Amitabh came to Boston. We have been thankfully here for almost last 20 years. I moved around a little bit for my trainings. So then I did my exam, and it took, for those who are planning to give the exam, I can say, even with all the things I was doing, I was able to finish my exam within a year. So because they had also added another exam at the the year I was giving my exam was CS. I think they call CS2 or something like that, which is a clinical skill exam. So you have to really look at the patients and, like a little viva and exam like we have in India, right? For practical exams. So that was an additional step the year I gave. So obviously when you do your exam, I think at the time, internet, computer, cell phone was, it seems only 20 years ago, I would say, but those who are young, who are only 25, actually for them 20 years is a long time. But now those, us, who are turning 50, 20 years seems like, okay, 20 years ago, we didn't have the cell phone access everywhere. We didn't have internet access everywhere. So what I was going to tell you. Yeah, so the exam was the preparations and all, like there were not things that you can talk to anybody easily and connect with people. So when you are alone, it was harder to connect with people. But then we had a PC and I got some people how to prepare for exam, because Amitabh's preparation was very different than what I did, because there was one additional step, and also I was doing with a lot of other things. And I never took a course. So those who think that you really have to spend money on the course, I think you can do it on your own. Obviously, if you can afford, course makes it easy to do, because it gives you really kind of cooked material, which tells you how to prepare for exam or what kind of questions will be there. But those who do not have those resources, you can still do it. It's not really that bad, because I can say our medical school teaching was very good, although the pathology training was suboptimal. Meaning it's a great institution, but what world does as compared to that, I thought our pathology training was quite suboptimal. And the exam is more based, it's theoretical exam basically, and it's more based on your kind of theoretical knowledge, which is a lot actually. The way we actually take exams in our MBBS, and I'm sure in dental school also, I think it's not hard to do it. So after exams, you apply, and it's almost a year cycle. That the year you apply is in September, you will apply, and then you start in July. So it's almost a whole year.
And some people say that if you want to apply for some college, it's good to have some observership there, that helps it. You make a bond with some teachers. Teachers appreciate that you are hardworking and you are oriented towards research. You are a dedicated person, so that improves your admission chances. Is that so?
Yeah, so I was coming to that. Yes, observership is something, I think it helps you in few ways. One, that kind of when you do the observership, you also get a little comfortable with the environment. And I would say all of that was maybe more the things of past, when world wasn't connected, when Western world was very different than the Eastern world. Now I think everything is the same. You watch same movies, you watch same shows, you are totally familiar with the culture, and like I think so, because now we're so global that I think that doesn't really affect so much. I can see how people, those maybe who were coming 30 years ago or 40 years ago, it was a totally different world. Even for us, it was a little different, because I did not watch American shows. You know what I mean? Like, so it was all new. And when the culture is different, then you may not feel so comfortable while you're going for interviews and all. But now I think that wouldn't matter as much. But what observership does is that it allows you to obviously see the system, but also you can get some good recommendations from one of the faculty member, and US recommendations are more valued than the recommendations coming from India. But let's say my recommendations were from there, Amitabh's recommendations were from there. The thing is that now observership has become very difficult, because the rules have changed so much for allowing anyone to be in our hospitals, and have a spot for them to sit and access the computer. and their core check and all of that is very complicated. Again, it's not that it's impossible, but it's much harder to get an observership. But obviously, if you get an observership, it will be good. And the best way to get an observership is through your alumni network. They can recommend you, then people also feel comfortable if they have a spot that they can give you an observership. And usually plan it at least a year in advance, because there are so many applications from everywhere. So you have to be prepared or know that I want to go next year and start from at least a year ago, from a year in advance.
Yeah, but this time this whole year has gone waste, I must say, in a sense that travel, observership, clinical work, all has come to.
For career planning this year, it was zero, kind of. That you can't really do much. And I think some ways it was also good. Yeah, obviously I can't say that this year was good, but in a way, you got the Zoom thing, or the virtual connections became so powerful and so efficient that I think they will last forever.
Yeah. That is the positive.
I never thought that I can talk to Dr. Devya Malhotra like this. And now if you want to do a meeting, I think we all feel so comfortable that I think that became a new platform or new kind of venue that, not all meetings have to be in person. Yeah.
Any suggestions you would like to give to the students regarding choosing the center where they can easily find admission, and which are the most difficult ones? So anything on that you would like to comment on?
I think it's a very difficult question to answer, because one, that it depends on your subspecialty, what you're going to go for, and a lot of other, I think, factors. But in very brief, I can say that, we did pathology there, and we only wanted to do pathology here. There was never a plan to do any other subspecialty. Pathology is one branch where you have some FMGs, or people from other countries, but so in a way people are used to taking people from other places, but also the seats are very few. It's a small subspecialty, as compared to internal medicine. So internal medicine, psychiatry, pediatrics, these are huge programs everywhere. Like they take 30, 40 residents per year, whereas pathology, very few programs, and maybe 4 to 9 at the most. So internal medicine and pediatrics and psychiatry are a good way to maybe start. And obviously medicine gives you a lot of other options afterwards, but you can always switch once you are in a system. There is a lot of flexibility which is allowed here. So let's say if you came into psychiatry but you didn't like it and you wanted to switch to internal medicine, if you did sincerely 1 year of your residency and then you want to switch, obviously you will be spending another year. But then if you impressed your your faculty and you showed them a very genuine interest that I don't want to pursue that, I think there are options that you can pursue with, you can switch within the same program. Obviously you'll have to go through the same process, but then by being in the system, it might make it a little easier. And obviously areas like Northeast are a little bit harder than the programs in South. Texas, and if you can go to Tennessee and places like that, and all places I think would be okay to live. There are pros and cons for living anywhere, so they all will be fine. And really what matters is if you really get a residency, even in a small program, not so great program, let's say, and you think that you will not get a better program next year, you can start still. And it's really the fellowship which matters a lot. So if you do a good job and if you move ahead and you get a good fellowship, that's what matters, because it's so subspecialized that you really practice what you what you're actually trained in a subspecialty fellowship. For example, like being a pathologist. Obviously, I did my residency in Boston area in Dartmouth Hitchcock, and but then I did my fellowships in gynecological pathology and genitourinary pathology. So that's what I practice. So even pathology within the anatomic pathology or surgical pathology is so subspecialized that really you are focusing on your basic, that subspecialty. Yes, I have a very wide knowledge of all other subspecialties, and I can practice very well that too. But all fields are so now narrowed down to what you practice is so fellowships are very important.
So open to you, Lipika, our student coordinator. Do you want to ask anything from the
Good
student?
evening, ma'am. Yes, I have a question to Mamta, ma'am. Ma'am, I'd like to ask if there are any, like, what would you say are the differences between the life or a career in pathology as compared to India and in the US? Like, what all are you supposed to deliver, or what does a general day in your office or in your hospital look like?
I'm sorry, is your question that how is the life different in
Yeah,
pathology,
exactly. If you were
US versus
pursuing that
India?
in India and in US.
I would say it's entirely two different worlds. And, you know, the pathology is really a clinical branch here, as opposed to how pathology is seen in India, that it's not, it just hurts to say it, but it's not practiced well. It's a very busy day. Like, for example, I have to find time to eat
Okay.
for myself. So it's a very busy day, but I can say that I work in a very big academic center, as Boston is kind of hub for medicine, and our centers are big and very demanding, workplaces. So on a service day, and like clinicians, you are on service, like how you're on call and what you're covering in a day. So all that is, there in pathology as well. So my day can be 12 hours long without any breaks, or it can be 10 hours long, and it requires a lot of teaching. But there are community practice options also, where you're signing out, earning more money, working a little bit less. But again, it depends on what your interests are, what your lifestyle you want to choose. But for pathologists, it's very sincere work you have to do. You're very accountable for everything you do. So for example, for me, morning 4 or 5 hours are just sitting with my trainees and signing out cases. And that means, I would sign out at least surgicals. I can say some weeks I sign out 150 cases by myself. The other subspecialties where there are a lot of resections, I might sign out a little bit less, but it's all your responsibility, and you are guiding the entire surgical team, basically. So for example, as I was talking, Dr. Mehrotra in the morning, or maybe on the text, I was saying that 9 to 10, I have a meeting, right? So for everything we do, there are tumor boards. So for example, 9 to 10, we have our gynecological pathology tumor board. What that means is that there will be surgeons, there will be radiologists, there will be radiation oncologists, and there will be even palliative care people. And we all have to present our cases, everybody present their part, and that's where the further managements are decided. So you're very accountable for everything, even for, let's say, you found lymphovascular invasion. How extensive that lymphovascular invasion was. Was it like in one slide you saw? Did you see 5 vessels involved? So they can go into that much of minutia. So I think it's a very busy branch, especially if you're working in a big center. But if you're working in a smaller center, it's not that challenging. But again, you're very accountable for every little thing. And I would say pathology is probably, even I can say here, many people don't realize, requires a lot of skill and a lot of knowledge. It's like internal medicine, really. You have to know a lot. It's not just just one thing. You're dealing with the entire hospital, whether you are in AP or CP, clinical branch, or you're in surgical pathology, you really are interacting with everyone. Does that answer your question?
Yes, ma'am. Thank you, ma'am.
So being at Harvard means you have been to best of institutes, KGMU, then SGPGI, and then at Harvard. So how different it is regarding medical education? Uh, what we have been practicing here is teacher oriented. So if the teacher is good, the classes are good, the studies are good. But everywhere else it is student oriented. Although we here are trying to be student oriented, so the curriculum also has been revised and things are being done for students. But what else would you say that we should be, we as teachers should be changing in our role to have better education delivery?
Yeah, I think it, again, I guess it's a very different system. What I can say that, for example, here everything is applied education. I can say that as a medical student, when I look back, our education wasn't bad, meaning one that we had a very extensive schedules, right? And there were a lot of clinics we had to do and do things. But medicine, unfortunately, have been sort of a very important, very respected field, but at the same time, in terms of education, a little bit more neglected. It's not at at the scale, at kind of international platform. We weren't there. Now I see a lot of people, in a lot of conferences and all of that, people coming and learning new things, but still it's been seen as, or been practiced as, a money making business style thing, less academic oriented. So I think that probably is there in the student population also. So it's, and the teachers also are busy in their private practices, leaving the clinic, focusing more on their clinics. So I think that dynamics has to change. And obviously the teachers probably are now realizing that they cannot be like a school headmaster. I'm sorry, I don't know from where my cat actually appeared. Oh, okay. So say hello to everyone. Say hello to everyone. Yeah. Ike, Ike, come here. I'm sorry. Yeah. So to be more open with the students, like a not very yes sir type. Obviously you have to respect your teachers, but including them, as you're saying, including them in the curriculum design, that what should be taught. But that also requires a little bit of experience from the student side, that maybe senior students can help, that what they thought they missed out on the on their education in 4 years when they look back. So I think that would be something to do. Like here, I'm involved in medical school teaching, and obviously there is all the planning is done by the teachers, but there is a lot of feedback, like what we should have done better, and try to improve that. And good teacher will always remain a good teacher, no matter what system you actually apply, because ultimately we have to teach. And where did you come out? So really, students would love the classes of a good teacher. That will never change. But the curriculums should be designed in a way that even no matter how the teacher was, an average student will at least learn an average level of knowledge that they can go and practice anywhere with confidence without making many mistakes.
Are you in contact with the department here, or do the people or the faculty members are the faculty members connected with you?
Yeah, I think we have the light is changing. Can you guys see me now?
Yes, off and on.
Okay, so let me just switch my chair, I think, because I'm doing it from home. So is it better now? Yeah. So yes, we are in touch with our both KGMC and SDPGI departments, because they also do from one that we are from Lucknow and we always go back to Lucknow. So it's easy to keep that connection. Um, we try to go and say hello to some of our more favorite ones for sure. Uh, but then they also organize sometimes the lectures and a session,
Easier now
and
to have things online and get you online for some discussion or tele discussion or things like
education this year had been very, very busy for us. um, I would say there was one request before which I couldn't do it because there was a clash, and I'm not sure how active they are right now in organizing the conferences. There was another one for January, which is again a very busy month. So we have not been able to do any conferences in India actually through Zoom or anything, but it will be easy because we have done some national conferences which were all converted into Zoom platform this year, and they went very well. Obviously there was a lot of effort from the organizers, um, but just very small sessions can be done on a individual level too. Yeah. No, we have not done anything in India this year, but generally we come in January because there is a conference which happens in January, which is done by international pathologists, just from mostly from North America. So we are usually part of that. So I come in January. So I'm going to miss January trip this year to India.
yeah. Any other questions from the students?
No, ma'am, no such questions. No more questions.
I know.
Okay.
Yeah. Okay. So it was really nice of you to join us.
Thank you. My pleasure.
It was good to hear from you. It was good to see you actually. And
Same here.
yeah.
And I can see many, actually none of the students I can see really.
Can you all put on your video?
No, I think they are all probably joining from, because I don't see anybody's video here.
Everybody has the video off. Can you all
Oh,
switch on your
switched
video
off.
so we can have a photograph? We'll have a quick photo.
Hello. Yeah, it's nice to see the faces. Yeah. And definitely keep in touch with your with the people you think you can be benefited, in the sense that they can always guide you in your email addresses. Now it's so easy to actually connect, because definitely we have helped so many people who have reached out. If we can make an observership for them somewhere, or in after pathology training, if they wanted to come for 2-3 months to do a specialized training, we try. As I said, over the years rules have changed a lot, because of the terrorism and all, that they do a very extensive paperwork, and then now they started charging also for observerships. So that makes a little bit harder. Not for, I think not for the residency observership, but the post-residency observerships.
Are you all going to switch on your video or not? If you, please, all of you have your videos on for the final photo.
Hello, everyone.
Nikhil.
Hello, ma'am.
Mudit. Subhanshi.
So maybe I would say hello name-wise. Lipika, I see. Richa, hello.
Hello, ma'am.
Pankuri, hello. Kunal, hello. Ayush, hello.
Hello, ma'am.
Ankit,
Hello,
hello.
ma'am.
And I don't see your name. Maybe you can say your name. 2E4 Cafe Zero. I don't know what your name is. Hello.
Hello, ma'am.
Rituparna. Hello. Ashi, hello. Nikhil, I don't see you. But hello. Subhashini, hello.
Yeah.
Navneet, hello.
Have your videos on.
Yeah. Navneet, hello. Mudit, hello. Even if I don't see you. Naman, Namrita, Greta, Devashish, Kushal. Hello, everyone. Vishal, Shivam, Aman, Ramesh, and Nikhil. Hello, everyone.
So I'll take a picture because they are not putting their videos on, so that's fine.
They're joining actually one by one, I see. Yeah, people are coming and going. You must, did you guys have a long day?
You can speak up.
I guess, ma'am, it is actually the time of evening votes for majority of them. So I guess they are in the postings and all.
Oh, so how are things now? How are hospitals working right now? Fully
Uh,
as usual?
Yes,
Mhm.
yes, ma'am. Like, though we don't have as much postings, like the patient exposure is limited. But yes, we have them. Like, it's not exactly prohibited, but we have them to a lesser extent.
yes, 30% of the work is on, and COVID hospital is the main focus these days. So even in all the departments, we see a limited number of patients in the OPD, limited number of cases in the OT. So everything is.
Because dental is very challenging. I myself have not gone for my any dental appointments because I just feel like I cannot open my mouth and like be in front of anybody. Obviously, they're all using PPEs, but it just didn't feel very comfortable. So I'm sure that that's affected a lot, right? But people are just doing all the weddings and everything in India, and I worry that there might be a surge after this period.
Yes, we felt that too, but now there's no scare. Everybody is just walking around with no mask at all. So I don't know what is going
Really?
to happen. And everywhere else, the second wave has been deadlier, and I don't know what is going to happen in India.
The only advantage India has is that the population is very young, so that helps with the mortality rate. But obviously, there are a lot of older people also, so it's scary. But I think mask is the least anybody can do and anybody can make at home. So maybe you guys should encourage everyone you see on the street or anywhere, because we luckily live in a very good state that everyone is very strictly following all the rules. So that's good. That's so far we are doing
And
much better.
if you see here on the fourth number, can you see
I'm
uh,
sorry.
the fourth screen? I don't know how it is on your. You can see Pankuri Merotra.
I'm sorry.
Can you see
You know,
Pankuri?
my cat is actually turning today wild. What's the problem, Ike? What is the problem? Where did you come out? Let me just push him. Yeah. Okay. Sorry.
Yeah.
Okay. So what were you asking, Divya? I'm sorry, I missed.
I was saying, can you see Pankuri Merotra somewhere on the screen?
Yes. Uh-huh.
My daughter.
Yes, I do.
And Richa Khanna is the faculty member in dental.
Hi.
We both were from the placement cell, and this some of the students from the placement cell have organized this.
Oh, nice.
Yeah.
Thanks for organizing this. I think this is a great, sort of effort for people who are planning their careers. Oh my goodness. This is,
So
my cat is actually can be very naughty at day.
let me share a certificate for you.
Sorry.
Let me share my screen and present you a certificate.
Oh, thank you.
It's a pleasure to present you this certificate. For
Thank
sharing
you. Thanks,
talent.
Divya.
Yeah, thank you so much. I'll send it to you on your mail also.
Yeah, and you can share my email address with the students. If they have any questions, feel free to reach out. But just be careful that you may not hear back from me immediately because it gets crazy and it takes time. And but feel free to post your questions or any queries wherever we can be helpful.
You know, Dr. Mamta Gupta was my
Yeah.
city senior.
I'm
So
sorry.
I'm telling the students that you were my city senior. As a
Yeah, actually, we should. Oh my God. What's your problem, Aya? Yeah, we actually probably traveled together at least few times, right? And Divya, your room used to be next to mine too.
yeah,
in old VL, right? Old VL. Yes. And these guys will work all night with their machines, making, finishing their projects. I remember that. Those were sweet days. So I think one important thing, maybe you all know a lot, but it might also be for you all are very young, but anybody planning to move here should also look into a little bit of lifestyle things. What will change from there to here? Meaning there are lots of things you will like, but you'll definitely miss a lot of culture, which is very little you can see in the northeast part. But for example, in some of the states like Texas and all, there are towns which just functions like India. So that might be another thing to kind of consider when
you have to create mini India in your own home. And we can see that.
Yeah, so this is a little thing you can see here is obviously Indian, because I'm a very folk sort of art person. So I like everything. That's why I think India is great in that regard. And I always think that I wish that we had the same standards of medicine, as we are doing pretty well in some of the computer fields. I don't know why medicine is so neglected in terms of our knowledge and education, and especially I think fields like pathology and psychiatry are very behind. I'm not sure about the surgical branches. There is a lot to achieve there. Shift the focus a little bit from just the business side of it to more academic. And you see, Divya, you have done so great. Like, she was always a smart girl, and I'm not surprised that she's where she is now, and very active. So that's good to see you in the same form, and you haven't changed at all. You look still the same.
Okay. See you then. We'll come to your center and visit you sometime.
Sure. Yeah. Anytime.
Yeah.
I hope this goes away and everyone can travel again.
Yeah. Okay. Thank you. Bye-bye.
Thank you. Thanks. Bye, everyone. You too. Have a good night.
Happy holidays.
Thank you, so ma'am.
Same to you.
Thank you, ma'am.
Bye. Thank you. Bye-bye.
Students, you have your feedback form and you have to fill in to get your certificate.
Sure, ma'am.